Welcome to the deep dive. Today we're jumping right into pregnancy, what you can generally expect.
Yeah, we've looked at sources covering, well, everything from the first signs through all 3 trimesters, right up to labor.
Exactly. And our mission here is pretty simple, just to give you a clear, concise picture of the key stages and changes. Ready?
Let's do it. It's quite a journey, those 9 months.
Okay, first trimester. Let's talk early signs. I mean, things like breast tenderness, right? And maybe needing the bathroom more often.
Definitely. Increased sensitivity or size there, more frequent urination, fatigue is a big one too, and of course morning sickness.
Ah, yes, the famous morning sickness, which, as we know, isn't always in the morning.
Not at all. It tends to kick in around week 5 or 6.
Yeah.
Typically peaks about week 10 and often starts getting better by week 16. It's mostly hormonal shifts.
16 weeks. Okay, so there's usually light at the end of the tunnel. Any tips for managing that nausea?
Yeah, the usual advice is often helpful. Small, frequent meals instead of big ones. Staying hydrated is really important. Maybe avoiding foods or smells that seem to trigger it for you.
Right. Simple, but hopefully effective. But when does it cross the line into needing medical advice?
Well, if the nausea or vomiting is really severe, like you can't keep fluids down, then absolutely talk to your doctor or midwife. There are things they can do.
Good point. Okay, moving on. Second trimester. Often feels a bit better, right? More energy.
For many people, yes. That first trimester exhaustion can lift, which is a welcome change. And later in this trimester, something really special starts.
You mean feeling the baby move?
Exactly. Those first little movements, they're often described as a fluttering. It's quite subtle.
So subtle you might mistake it for something else, like gas.
Precisely. You might wonder, was that? But it's the beginning of feeling that connection. It's usually towards the end of the trimester you notice it.
That's amazing. What about physical changes? I know there can be skin pigmentation stuff.
You might notice nipples and the areola getting darker. Maybe that dark line down the belly, the linea nigra, appears or darkens. Sometimes patches on the face, too.
And that usually fades after the baby arrives.
Yes, typically it fades post-delivery. Other things you might encounter this trimester? Maybe constipation. Heartburn can kick in, some pelvic joint discomfort as things stretch.
Right, the body's really adapting. Okay, then we hit the third trimester. Baby's bigger. Movements are stronger.
Oh, yes. Much more distinct kicks and rolls, sometimes strong enough to keep you awake at night.
Huh, I bet. And this is also when Braxton Hicks contractions might show up, the sort of practice runs.
That's a good way to put it. False labor, practice contractions. The key thing is knowing how they differ from true labor.
Okay, so how do you tell them apart? Our sources had a comparison, right?
They did. Braxton Hicks are usually irregular. They don't get stronger over time or closer together. And sometimes changing what you're doing, like walking around or resting, makes them ease off.
Whereas true labor contractions, they find a pattern.
Exactly. They become regular, they get progressively stronger and more frequent, and they don't stop if you change activity. They keep coming.
That distinction is pretty crucial for knowing when it's, go time.
Absolutely. The general guideline people often hear is the 5-1-1 rule.
Right. Contractions every 5 minutes, lasting for about 1 minute, and this pattern continues for at least 1 hour.
Yes, though always follow the specific advice your own healthcare provider gives you, as it might be different based on your situation.
For sure. And besides contractions, are there other signs that mean head to the hospital now?
Definitely. If your water breaks, whether it's a gush or a trickle, any significant bleeding is another immediate call. And crucially, if you notice the baby isn't moving as much as usual.
Don't wait on that one.
No, never hesitate to get checked if you're worried about baby's movement. Better safe than sorry.
So wrapping it up, we've walked through the trimester's early signs, feeling baby move, those practice contractions, and then the real signs of labor.
Yeah, just understanding the basic progression, what changes to expect, and importantly, when to seek help or advice.
It really is incredible thinking about the whole process your body goes through. Being informed about these stages feels pretty empowering.
It absolutely does. Knowing what's likely happening can make a huge difference in how you experience it all.
Well, that brings us to the end of this deep dive. Thanks for joining us. Maybe take a moment today to just, reflect on the amazing things the human body is capable of.
It truly is remarkable.